Which of the following problems would result from platelet deficiency? So before we look at the choices, let's just review what platelets would do, so then we can understand if we have a deficiency or a decrease in the amount, what kind of effect we would have on the body. So normally, if let's say that this is the skin, and let's say that there's a break in the skin, there's a cut, there's some sort of bleeding, normally the platelets would rush to the scene and they would sort of bind up the area to prevent prolonged bleeding and then lead to clotting, which eventually would cause you to get a scab that covers up the area so that you're no longer bleeding and that the bleeding is prevented. So if there were a deficiency or a decrease in the amount of platelets that we have, then we would say that some of these platelets that we drew onto the site would be missing. So deficiency, deficiency, deficiency. So there'd be very few to none, if it's very severe, platelets. And therefore, the bleeding would not be prevented well, and it would prolong, and you probably wouldn't have this scab here, and you would just keep bleeding. So we need to have platelets. Again, you don't want too much of anything, because if you have too much bleeding control, that could lead to clotting, which could cause other issues in the body. So you want that happy medium, but you need to have platelets, and if you have a deficiency, that would cause prolonged bleeding and issues to the body. So let's see if any of these choices match that. It looks like option D here says difficulty in blood clot formation at the site of the injury, which really matches what we were saying, because if we don't have enough platelets, then we would have difficulty controlling the bleeding, which would lead to difficulty forming blood clot formation. So option D is looking like our correct choice, but let's just review the other options. So option A says difficulty in the transport of oxygen in the body, B is difficulty of transport of nutrients in the body, and C is difficulty in fighting infections. So all of these things could consequentially happen if you don't have the bleeding controlled. Option D would be our best choice because that's the definition of what happens if you don't have enough platelets. You wouldn't have blood clot formation, you would have prolonged bleeding. Sure, if you don't have that blood clot formation, it could lead to difficulty in transport of oxygen in the body, because if you have oxygenation of cells through hemoglobin in the bloodstream, it could potentially cause issues in circulation if it's severe enough, if you have prolonged bleeding and you can't get that blood to circulate, which is what leads to someone dying out from too much bleeding. But that would be down the road. That's not just at this point here, the platelet deficiency causes difficulty in blood clot formation. This is kind of like what could be led to by option D occurring. So options A and then option B would be later, not what we're looking for right now. Option D would be a better option. And then option C, difficulty in fighting infections, that has to do more with your immune response and your white blood cells, so not really related to the platelets and the bleeding control. So for this question, option D, difficulty in blood clot formation at the site of injury, would be your best choice.